Medication adherence is a very widespread issue across the UK, to the extent that our best estimate is that 50% of patients are not taking their medication correctly. And that has huge consequences on two levels. Firstly, just the wastage of drugs. Up to £300 million a year is wasted in medicines not being taken. But then there's the human consequence. Patients not taking that medicine don't get better. In fact, they get worse. And that causes repeat GP visits, hospital visits, and deterioration of the conditions. That in itself costs the NHS a further 500 million. So it's a big issue and it's very widespread.
People don't take their medicines for a number of reasons, and it falls into probably three main reasons. The first one is simply forget. We live busy lifestyles. Taking 4 tablets a day, it's quite easy to forget the odd dose every now and again. So forgetfulness is probably the majority, and I think it's worked out that about 65% of medicines are missed due to that. The next cohort, about 20 to 25%, take them because of the perceived lack of, the perceived side effects that they will have, or they suffered from the side effect when they started a medication and simply just stop taking them. And the third reason, patients stop taking the medication because they don't feel ill. So they're being prescribed medication for a condition that is symptomless. So for example, high blood pressure or cholesterol. They don't perceive themselves to be ill, so they don't take the medication. The best person for people to speak to is the local community pharmacist. There are 14,000 community pharmacists out there. You don't need an appointment. They are experts at medicines and how they can work, and they've got lots of useful advice and hints and tips of how they can actually help improve medicine compliance. A good way for people to remember to take their medication, if they're taking it every single day, is to try and take it at the same time each day. Other tips to help improve their compliance is to set reminders on their phone. So if they're taking medicines 2 or 3 times each day, just a simple alarm or alert on their mobile phone is a very useful way for people to remember to take them. If you fail to finish a full prescription, there's a number of consequences. One, if it's an acute antibiotic and you're being given a short course by your local doctor and you feel better halfway through the course, what could happen is the infection can come back more severe and it can have some long-term consequences. The other aspect, if you don't fulfil your prescription for a long-term chronic condition, for example diabetes, your blood sugar levels can become out of sync, and the long-term consequences are huge.
This campaign is all about raising awareness on 2 levels. First of all, we want to talk to the public. We need them to understand the importance of taking medication properly as prescribed by the doctor and the long-term implications if they don't. On another level, we want to shout out. We want to shout out to the NHS, to government, to all the health professions that we must start tackling this issue. It's too big now, and we all need to put our heads together and find some long-term solutions.